next is अथातो बृहन्दराणां व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः पञ्चभगन्धराः व्याख्याताः तेषु असाध्यः शम्भुकावर्तः शल्यनिमित्तश्च शेषाः कृच्छ्रसाध्याः. Now in the Nidanasthana we have discussed about all the varieties of the Bhagandara, and that prognosis also is mentioned in the Nidanasthana. This is a repetition like Shambhu Kavrata, and which is produced due to the foreign bodies. And then Tridoshya Bhagandara are Asadhya. That's about the prognosis. Now the principles of the treatment would be तत्र भगंधर पिडकोपद्रुतम् आतुरम् अपतर्पणादि विरेचनान्तेन एकादश विधयेन उपक्रमेत अपक्वपिडकं पक्वेषु च उपस्निग्धम् अवगाहस्विनं शय्यायां सन्निवेश्य अर्शसां यन्त्रयित्वा भगन्धरं समीक्ष्य पराचीनम् अवाचीनं वा ततः प्रणिधाय एषणीं उन्नम्य साशयम् उद्धरेत् शस्त्रेण अन्तर्मुखे च एवं सम्यग् यन्त्रं प्रणिधाय प्रवाहमानस्य भगन्धरमुखम् आसाद्य एषणीं दत्त्वा शस्त्रं पातयेत्. आसाद्य वा अग्निं क्षारं चेति एतत् सामान्यं सर्वेषु. Now before the bhagandara occurs, there would be a pidaka stage. That's the abscesses which can occur, and the abscesses, location of the abscesses could be anywhere, like either it could be supralevator, or it could be intersphincteric, or the ischioanal, ischiorectal. This is the most common variety of the abscess, or perianal abscess. Now during this condition, when the patient would have the pidaka, depending upon the stage in which the patient is presented, if the patient is presented in the early stage before the pus has been formed, then the treatment would be, the protocol of the treatment would be like the bhagandarachikitsa. Apadarpanadi, alepan, virekantah, ekadashopakramah, those are to be done. If this stage is passed and the patient has resulted in a suppuration, pus forming condition, then the most important part is the location of the abscess has to be confirmed, like the whether it is a supralevator or whether it is a intersphincteric and or ischiorectal, and this location is identified with the probe. Now in Sushrutas period, it was a probe which was used, like you will have to confirm like whether the bhagandara is parachina or avachina. Parachina is much deeper, avachina is superficial, and this is done with the eshani. And with the eshani, you have to identify that location and drain the abscess, and the whole of that abscess cavity has to be removed. Sashayam uddhareta. There has to be a removal of the whole cavity. It has to be curated out. The internal surface has to be curated out. Of course, even now, the principle of the treatment is the same. Whenever the patient presents with the abscess at that level, it has to be drained. The only advantage now would be you will be able to locate the abscess much better, more accurately with the ultrasonography, whereas Sushruta had to use a probe. And the important is the pus has to be drained out completely, and the internal surface has to be curated. So sashayam uddhareta, all that possible collection has to be drained out. Then once the patient has developed the fistula later, now if the abscess is drained successfully, there is a high possibility that it may get cured and there may not be a fistula. But if at all there is some residual fibrous substance which is left over, which tend to occur due to the anatomical reasons over there, because you have lots of fat tissue, and there is also a chance of the contamination with the fecal material. The two factors which make the ischiorectal abscess result in a fistula are either a continuous sepsis produced due to the contamination of the fecal material, or fecal organisms also move over there, and the other is a fat tissue, which we have again discussed in the Nidanasthana. And these two factors can result in a fistulous tract, and the fistulous tract could be presented in many manner. It could be a single opening, or it could be multiple openings, track out, and all that later complications could occur. Now, in case of Vataja Bhagandara, which is the Shataponaka, there will be multiple openings which are produced due to the same ramifications of the tracts within the fat tissue. The treatment approach would be, whenever there are multiple openings there, Sushruta says the principles of the treatment according to Sushruta is Nadyantare Pranam Kuryat Bishaktu Shataponake Tasah Teshu Uparvidheshu Sheshaha Nadihi Upacharet गतयो अन्योन्यसम्बद्धाः बाह्याः छेद्यास्तु अनेकधा नाडीः अनभिसम्बद्धाः यश्चिनत्येकधा विशक् स कुर्यात् विवृत्तं जन्तोः व्रणं गुदविदारणं तस्य तद्विवृतं मार्गं विन्मूत्रम् अनुगच्छति आटोपं गुदशूलं च करोति पवनोभृशं तत्र अधिगततन्त्रोऽपि विषं मुख्यात् असंशयं तस्मात् न विवृतकार्यो व्रणस्तु शतपोनके. When there are multiple openings, the most important part is you will have to decide which is the main tract. There will be multiple ramifications of the tract, and the difficult portion is to confirm which is the main tract. And all that external openings have to be connected together to result in a single tract, and then that single tract has to be removed. So, according to Sushruta, and even now the principle is the same, that multiple tracks have to be unified, and then you'll have to drain out the main track as such. And the whole process is a very complicated process. There is always a possibility of confusion, and if at all there is such a confusion, and then you have opened the track inadvertently or in the wrong manner, and resulting in a huge tissue loss that can result in incontinence, gudavidarana. Incontinence can occur and the wound may not heal as such. And this Sushruta says even an expert, an expert physician may get confused, and hence you have to be very careful. To achieve that result, the technique of uniting these multiple tracks could be the incisions have to be made at a definite shape, and those are Vyadho tatra bahutchidre bishata vaividanada ardha langalakaschedah karyo langalakopi va sarvato bhadrako vapi karyo gotirthakopi va sarvatas sarvamarganstu dahed vaidyah tatha agnina sukumarasya bhirohi dushkarashataponakah. In the multiple openings, external multiple openings, they have to be connected together in a pattern, and those patterns are either Ardhalangalaka or Langalaka or Sarvatobhadraka or Gotirthaka. 4 types of techniques are suggested by Sushruta. The word meaning of Langala is the plow which is used to plow the field. Langalam halamuchyate. Ardhalangalaka iva Ardhalangalakaha. Now I will show you the shape next. Sarvatobhadrastu asanam visheshah parenkikarah mandala ankush sadrishah. Sarvatobhadraka is somewhat circular, something like a irregular shape or a curved shape, semi-circular or circular shape as such. Gotirthaka is a haphazard, like zigzag. The word Gotirthaka comes in like a track followed by either the urine, the track of the urine of a cow moving around. When the cow urinates walking around, the track would be curved like zigzag. Or even there is another comment like the Gotirthaha Goyonihi. It's of the shape of Goyoni, vagina of the cows. So Gotirthaha Gachato Gomutra Gachasadrusha Atha Gotirtha Goyonihi Chite Tadakarah Gotirthaha Athava Gotirtham Nipanam Yenam Gavah Pibanti Tat Kurankitavat Sheda Vishesha Kartabyaha. Another opinion about Gotirtha according to Dhalana is it's something like the foot shape of the cows. When the cows move around, you will have the impression of the foot of the cow and a similar shape, something again irregular shape. Tatha tantrantaram dvabhyam samabhyam parshvabhyam chedo langalakam matah hruswam ekataram yatyaso ardhalangalaka smrtah sevani murdayitva tu chaturdha darite gude sarvato bhadrakam chedam ahuscheda vido janah parshvagatena shastrena chedo gotirthako bhavet. Now another opinion during the Dharlana's period was when the incision is made with equal 2 sides, that's called as the Langalaka. If one side is shorter and the other side is longer, that's Ardhalangalaka. And if you have a quadri-shaped or X-shaped or maybe plus-shaped incisions, 4 arms around, that's considered as Sarvatobhadraka. And if the incision is irregular, that's considered as Gotirthaka. Now, in the present day situation, exactly similar issues are done whenever there is a multiple openings. Even when you use the Kshara Sutra, it's important to decide which are the main tracks of openings, and these external sub tracks have to be connected together, as you see in this image. Like if there are multiple tracks, these two tracks could be connected together, and there is another track connected over here, and a main tract is identified. And of course, in this case, we have identified two main tracks, and the two main tracks are connected together with the Kshara Sutra. Now, the other way, conventional surgery, if you do not do the Kshara Sutra, it's a conventional surgery. You may connect them in different shapes. Now, that black line suggests about the shape of the Ardha Langalaka, where one arm is, Langalaka is a plow shape. Plow is where you have again a long arm and comparatively short arm. Now, if the shape is such that one arm is very short and the other is long, of this shape, that's the Ardha Langalaka. Or if that's black color incision, that red color line, it could be like Langalaka, or the blue colored shape could be the Sarvatobhadraka, or Sarvatobhadraka could be the other way. According to Dalana, you may have a crisscross shape, like if there is a opening to drain. Now the conventional opening which is done for drainage is a crisscross shape. Or both is the case irregular, where all the tracks are connected together in a zigzag fashion. Now, decision about this is done only when you know about the location of the main track, depending upon the pattern of the branches. So, to confirm like which is the suitable condition for a patient, you need to examine the patient thoroughly. If necessary, a fistulography or maybe ultrasonography may be necessary. Whenever there are multiple openings, the investigations are necessary to confirm the tract. By palpation, of course, to a great extent, you can make out these tracts also, but still there is a possibility of some errors, and hence it's better to have the investigations, and depending upon the findings of the investigation, you have to decide which is the main tract. Suppose in this patient, the main tract could be somewhere here at this level, and the multiple openings are connected together. Now, to connect the multiple openings, you may take up any of these patterns which will minimize the tissue loss. Once these openings are connected and you have made it wide open, then you may put a Kshara Sutra to cut off the remaining tracts. Or if at all it is a Sushruda's conventional surgery, Sushruda has not suggested Kshara Sutra in the treatment. Even in the contemporary surgery, the opted line of treatment is not the Kshara Sutra, but of course you have at the end of this we will come to that different options. But one of the option is fistulotomy surgery, where the whole fistula tract has to be opened and then kept out as such. In that condition, you will have to make an incision over here, also keep the tract open. That's the option of the treatment in case of multiple openings. Now, once you have done that, the next post-operative procedure is रुजास्रावाः तत्र स्वेदम् आशुप्रयोजयेत् स्वेदद्रव्यैः यथा उद्दिष्टैः कृशरापायसादिभिः ग्राम्य आनूप औदकैः मांसैः लावाद्यैर्वापि पुष्किरैः वृक्षादिनीम् अथैरण्डं बिल्वादिं च गणं तथा कषायं सुकृतं कृत्वा स्नेहकुम्भे निषेचयेत् नाडीस्वेदेन तेनास्य तं रणं स्वेदयेद्भिषक् तिल एरण्ड अतसी माशयव गोधूमसर्षपान्न लवणानि अम्लवर्गं च स्थाल्यामेव उपसाधयेत् आतुरं स्वेदयेत्तेन तथा सिद्ध्यति कुर्वतः स्विन्नं च पायेदेनं कुष्ठं च लवणानि च वचा हिङ्गु अजमोदं च समभागानि सर्पिषा मार्द्वीकेन अथवा अम्लेन सुरासवीरकेण वा ततो मधुकतैलेन तस्य सिञ्चेद्भिषक् व्रणं परिषिञ्चेत् बुधं चास्य तैलैः वातरुजापैः विधिना अनेन विन्मूत्रं स्वमार्गम् अधिगच्छति अन्ये च उपद्रवातीव्राः सिद्ध्यन्त्यत्र न संशयः शतकोनकः आख्यातः. Now, to reduce the pain in the post-operative period, one of the option is swedana, fermenting. Fermentation, either something like what we do now is 6 bar. Now we do prefer to have the 6 bar. Sushruta had suggested swedana as well as maybe the 6 bar also is considered. Swedana could be done either by applying hot substances with the krishara, payasa, etc. Krishara, payasa are thin liquids or thick liquids. Payasa is a thick liquid and krishara is a thin liquid which is warm, which could be prepared out of either non-vegetarian material, fleshy material, brahme, anuka, abudaka mamsaihi, etc. The mamsas of different muscles, fleshes of different animals and birds, or it could be of plants like eranda, bilva, vrikshadini, etc. With the kashaya, you can have the nadi sweda also, another of the option, or it could be application of the hot substances over the area, warm substances over the area. Or it could be even Swedana in terms of the Parisheka, where you have the Kashayas, the liquids with the Lavana and Amlavarga, and in that vessel the patient has to sit, what we call them as a sitz bath. In the present day situation, the more popular is a sitz bath in the post-operative period. And for the sitz bath, you may use any of these Kashayas which will have their own benefits. Then after that, the next is about the internal administration of the drugs as well as the diet. Internal administration would be, you'll have to give Deepana Pachana Ushadi like Vachahim, Gojamoda, etc. with Grita, or you'll also have nourishing diet like Mardvika, that's honey, as well as Surasa Viraka, etc. and Madhuka Taila can be applied, local application of the Taila to promote healing with the Madhuka Taila, and or any other Vata Rujapara Taila. This is one of the protocol. With this, the patient may have a normal passage of the stools and all the complications will be healed as such. The next is Gustagriva, that's a Pitta Bhagandara, where you will have a single huge swelling which is actively inflamed. Ata Ustagriva Meshitva Chitva Ksharam Nipadet, Putimamsa Vipohartam Agni Adrana Putitaha, Athena Gritasanstehi, Tilehi, Pistehi Pralebeta, Bandham Tato Anukurvita, Parishekam to Sapusha. Tritiye divase mutayata swam shodhayat bishaka tata shuddham viditva to ropayattu yathakramam. Now in case of Ustagriva Bhagandara, which is actively inflamed, where there is a lot of pus and necrotic tissue, the important is it has to be drained effectively, and to facilitate the complete curative, Sushruta advises application of the Kshara. So it's making an incision, draining out, and after drainage the Kshara is applied, not the Kshara Sutra, that's the important thing. And according to Sushruta, in case of that acute inflamed conditions, cautery should not be used. Cautery is not preferred. Of course, in the present day situation, even in infected conditions, cautery can be used, but cautery has a risk of extending the damage. So we have to be very careful and reserved when we use the cautery. Then after that, the Gritatham Stehi Tilehi, the tila with the Grita has to be applied over there, lepa has to be applied, and the bandage has to be done, and cleaning of the wound with the ghee again, Parishekam Sarpusha, and you have to follow all the protocol of the bhagandarachikitsa. After third day, you have to change the bandage, and Shodhana and Ropana has to be followed. Paristravi is fibrous to tracts, Kapaja Bhagandara, where the whole tract is fibrous and the pus discharge is lesser, active inflammation is not seen, and majority of the patients whom you see in the clinic would be of this variety, the Kapaja Bhagandara like. In that condition, Utkratya Asrava Marganstu Paristravani Buddhimana, Ksharena va, Sravagatim Dahed Kutavahena va, Sukhosnena Anutailena Sechayed Gudamandalam, Upanaha Pradehashta Mutra Ksharasamanvidaha, Vamaniya Aushadhi Karya Parishekashta Matraya, Mrutubhutam Viditva Enam, Alpasravaruganvitam, Gatim Anvisheshastrena Chidyat Kharjurapatrakam, Chandrardham Chandrachakram va Suti Mukam Avamukam, Chitva Agnina Dahed Samyak Evam Ksharena va Punaha, Tata Samshodhanireva Mrutupurvehi Vishodhayeta. In fibrous tracts, where the acute inflammation is not much, and the openings are either one or two, not many, in that condition, the whole fibrous tract has to be excised. It is a fistulectomy surgery. And Sushruta suggests exactly the same. You will have to Utkrutya, the whole tract has to be excised, and after the excision, you may use Kshara or maybe Agni, cautery or Kshara can be used, and then followed by Anutaila has to be used to reduce the pain. Upanaha, Pradeha, Upanaha local application with the Mutra Kshara also can be applied, or the internal administration of Kapahara Aushadis, Vamaniya Aushadi, as well as local application can also be done. And once the whole area has become softer, that's all the fibrous tissue is gone, then if at all there is anything left over, you will have to treat that as a wound. Now to excise these tracts, again the plan of incision can be either Kharjura Patraka or Chandraardha, Chandrachakra or Suji Mukha or Avam Mukha. These are the techniques which are suggested. Now what is that? Kharjura Patraka is Kharjurapatraka is where you will have to identify one main long tract, and then there would be branches. Like suppose if there are multiple such fibrous tracts, the main two tracts are connected with a single incision, and all that internal surface is curated out, excised. And these branches also have to be connected together, and then they have to be excised. That's where you will have a shape which looks like a main stem of the Kharjura leaf, and then the branches like appearance. That's the Kharjura Patraka. So the concept of Kharjura Patraka is the same, where there is a main tract with the multiple small branches like appearance. And Chandraardha and Chandrachakra are either semilunar, where the whole area of the tissue is excised, this much of the tissue is excised, or the circular. Or Suchi Mukha is when a small incision is made around the tract and then whole tract is removed, excised. That's the real fistulectomy. Now all these procedures would be quite rigorous procedures, and they have to heal, the wound has to heal by secondary intention, and that's why the fistula surgeries are not very popular, and you have to wait till the patient, the wound heals in the secondary intention. Then Sushila has mentioned about an avamukha. Avamukha is where you will have to have a curved probe, go through the internal opening. You will have to put the this proctoscope and then identify the internal opening and put the probe on the internal opening and bring it out towards the exterior. A curved probe is used, and then the whole tract has to be excised to facilitate that. Now during whole of these procedures, probing is necessary. Now to decide like which is the tract, how to cut the tract, you will have to put the tract in and then excise. That's the important issue, phenomena. And even in case of these simple fistulectomy surgeries, where a tract is, if when it is a single tract, it has to be excised with the Suchi Mukha. If it is multiple tracts, then you will have to have a plan where the whole infected fibrous tissue is excised, and to have a plan, these are the options which are suggested by Sushila. Of course, even now, almost in a similar fashion, we do that, the excisions as such. Now, बहिरन्तमुखश्चापि शिशोः यस्य भगन्धरः तस्य अहितं विरेक अग्निशस्त्रक्षारावचारणं यद्यत् मृदु च तीक्ष्णं तत्तस्यावचारयेत. Now, in case of children, pediatric conditions, and when the bhagandara has occurred, irrespective of whether the opening is on the external side or the internal side, the surgical treatment may be having these difficulties, because the child may not be able to tolerate that stress of the surgery, and moreover the painful conditions, which is not easily acceptable. In such conditions, you will have to give internal administration of the drugs, which could be either mridu or tikshna. You will have to have maybe alternative choices so that the wound will heal. Or another option suggested is, though it's not surgery, the other option is आरब्ध निशा कालाचूर्णं मधुकृता प्लुतं अग्रवर्ति प्रणिहितं व्रणानां शोधनं हितं योगोयं नाशेत्यासु गतिं मेघमिवानलः अनिलः. The agravarti or suppositories or maybe wicks into the opening, so that there is a continuous drainage. See, the basic options of the treatment are suggested. In the first three varieties of these options, it is either fistulotomy or fistulectomy. Fistulotomy, keeping the tract open and facilitate drainage. The next is fistulectomy, where the tract is excised. The third option is to facilitate the continuous drainage. You will have to keep a wick on the external opening, so that all that infrared products which enter in would be continuously drained, and that continuous drainage may help in healing. So that's another of the option, the treatment in case of the fistula. And the agravarti is prepared with the arabudha, nisha, etc., with the madhu and grita, and that's what suggested as such. Then agantuje, in case of agantu bhagandara, which is asadhya, considered as asadhya, but still the treatment would be Visham Nadim Shastrena Mutkrutyatnaha Jambovastena Agnivarnena Taktayata Shalakaya Dahe Choktam Menimam Stamranam Susamaitaha Krimik Ninja Bidim Kuryadu Shalya Anayanam Yamata Pratyachya Yeshatarabhiha Vardyascha Pitridoshajaha. That Agantuj Bhagandara is considered as a Kricha Sadhya or Asadhya, and hence it is a Pratyakshya Vadi. The prognosis has to be explained, the poor prognosis has to be explained thoroughly, and then the treatment has to be followed. Whereas Tridosha Bhagandara is considered as Asadhya. And the basic principle again is same. the track has to be excised. And after following that excision of the track, it has to be cauterized. The surface has to be cauterized with the Jambosta Yandra or Saptaya Shalaka Yandra, which is heated. So cautery is the other part, and because of the possibility of maggot formation, Krimigna Vidhi has to be done, and whatever the possible foreign bodies which are there inside has to be removed. एतत् कर्म समाख्यातं सर्वेषाम् अनुपूर्वशः येषां सुशस्त्रपतनात् वेदना यत्र जायते तत्र अणुतैलेन उष्णेन परिषेक प्रशस्यते वातग्न औषधसम्पूर्णां स्थालीं छिद्रशराविकां स्नेहाभ्यक्तगुदस्तप्ताम् अध्यासीत सबाष्पिकां नाड्या वा अस्य आहरेत् स्वेदं शयानस्य रुजापहम् उष्णोदके अवगाहो वा तथा शाम्यति वेदना. To reduce the pain in all these interventions, there is a possibility of severe pain in the post-operative period, and to reduce the pain, Sushruta suggests about many options. The options one is Anutaila Nusnena Parishekaha. With Anutaila, warm Anutaila, the local application is that. Anutaila, even in the other chapters, we have referred to that Anutaila as one of the important methods by which the pain of the pain is reduced. One of the pain preventing measure, and description of Anutaila also we have discussed in the previous chapters. The other is you will have to have a device where a vessel which is containing a small opening, which has a opening lid with a small opening, and the vessel has to be filled with Vata any medicines which are Vatahara, and that has to be boiled, heated, and the steam of that is exposed to the anal area by making the patient sit over the top of the vessel. Maybe you may devise it having a stool and then a vessel below, or it could be Nadi Sweda, where you may have a tube and then with the tube the Swedana can be done, or it could be Usnodaka Vagaha, warm 6 bath. So options could be warm 6 bath, which is now more popularly used, or it could be steaming with either a tube or making the patient sit on a steam forming vessel, or parisheka of the taila. These are the options as such. Kadali Mridalopaka Priyaka Ajina Sambutan Karayad Upanahamsha Sarvanadin Chakshanaha. To facilitate the healing, the Ropana Shodhana and Ropana, either it could be Salvana Upanaha with the Kadali Mridalopaka Dravya, etc. You may have to have the Upanaha with the Lavana. Or the other is Katatrikam Vachahingu Lavanani Athadipyakam Paye Amla Kaulatha Sura Saviraka Divihi. Internal administration of Trikotu Vachahingu Lavana, etc., which is again Agnijipaka with Sura and Saviraka. Or Jyotishmati Lamdali Shama Danti Trivurtilaha Kustam Shatafa Golomi Tilvako Girikarnika Kasi Sam Kanjana Kshirio Varga Shodhana Ishede. The drugs which can be used as Shodhana for local as well as systemic uses are Jyotishmati Langali, etc. These could be used for Shodhana local as well as internal administration. And then the other drugs or medicines which could be used are Trivirtila Nagadanti Manjistha Payasasaha Utsadanam Bhavete Tata Saindava Kshadrasa Sayutam. When the wound is healing and if there is a hypergranulation, it has to be done with Utsadana, and for the Utsadana suggested dravya are Trivirtila Nagadanti Manjistha with milk. Rasanjanam Haridrebe Manjistha Nimbapallavaha Trivurtejo Utidanti Kalko Nadi Vranapaha. If the wound is persisting, the track is still persisting, the options are Rasanjana, Haridra and Manjistha with this internal administration, it could be used for Nadi Vrana. For the Vrana Shodhana, if the wound has lots of slough, then Kustam Trivirtila Danti Magadhya Saindava Madhu Rajani Tripala Tutham Hidam Syad Vrana Shodhanam. Another Vrana Shodhana Yoga. Then Magadhya Madukam Rodram Kustam Vela Hare Namaha Samanga Dhataki Chaiva Sariva Rajani Dvayam Priyangava Sarjarasaha Padmakam Padmakesharam Sudha Vacha Langalaki Madhuchistam Saindavam Etat Samratya Sambaram Tailam Thiro Vipacheta Etadvai Gandamalasu Mandaleshu Athamehishu Ropanartham Hitam Tailam Bhagandara Vinashanam. Another Ropana Taila Magadhyadi, that's Pipadhyadi. Madhuka Rodra, etc., they have to be added, and you will have to prepare a taila, and that taila can be used in other diseases like Gandamala or Mandala Kusta or even Bhagandara or even Prameha. Then Nekrodhadiganashchiva hita shodhana ropane tailam ghrutam va tatpakvam bhagandara vinashanam. Nekrodhadigana taila or ghruta also can be used in bhagandara as such. Trivurdanti haridra arkamulam loha ashwamarakau vidangasaram tripala snuhi arka payasi madhu madhuchishta samayuktai tailam eter vipachayet bhagandara vinashartham etad yogyam visheshatah. Another of the taila with the trivurdanti etc., which is suggested as an option of the treatment, which could be used for local as well as the systemic uses. Chitraka arko trivurt pathe malapum heparakam sudham vajam langalakim saptaparnam suvarchikam jyotishmatim sambrudya tailam dhiro vipachayeta etadhi sandanam tailam brisham dadyat bhagandare chodhanam ropanam jiva savarna karanam tatha divraniyam abeksheta vranavasthasu buddhimanna. Another of yoga which can be used for shodhana, ropana as well as savarnikarana. Chitrakadi, taila or ghruta which also can be used as such for the treatment. Then interestingly, Sushruta has not mentioned Kshara Sutra in the treatment of Bhagandara, but now that Kshara Sutra is considered as one of the Ayurvedic benchmark or Ayurvedic foothold for the treatment of Bhagandara. Now, actually, the Kshara Sutra is mentioned in the treatment of Nadi Vrana in Sushruta, but Professor P.J. Deshpande from Banaras, he applied that principle into the Kshara Sutra, and then the Kshara Sutra was standardized, and the whole protocol of the Kshara Sutra is done. In the surgical options, contemporary surgery, the options of the treatment for fistulae are many, but even after all that, the outcome is poor, and that's why Kshara Sutra technique has become more popular, because the solution which is available in the contemporary surgery is not very confirmatory. The different options are fistulotomy, where the fistula is open. Seton techniques is actually putting in a thread which is non-absorbable, and actually the Kshara Sutra is developed based on the same principles of the Seton. But instead of depending upon a simple thread, we now have a Kshara applied thread which will have its own advantages of healing as well as curating. Then advancement flap procedures, where the other choice of the treatment is, now as we know, in case of fistula, the causes for the continuous or persistent fistula is either contamination from the fecal contamination or the fibrous tract. The options could be either you have to remove that fibrous tract, either as in case of the fistulotomy, or in the Seton also it's curating out, removing the fibrous tract, and continuously draining of the contamination. The contamination should not be left over. Another option is to prevent the contamination, you close the internal opening so that the contents from the rectum do not reach to the anus. And this is done by advancement flap procedure, where the mucosa of the rectum is meant to cover the internal opening, or ligation of the intersphincteric fistula or lift procedure, where again the same, that the fistula tract is blocked with the ligation, or it could be endoscopic ablation. With the endoscope, the whole tract could be ablated out. In the laser surgery, of course, it's a fistulectomy, but instead of using the scalpel, use the laser so that the tissue destruction will be lesser. Fibrin glue and bioprosthetic plugs also are of the same principle as a flap procedure. Instead of having a flap of the tissue, you use these plugs to close the opening. Now, the techniques are fistulotomy, simple, exactly what's mentioned by Sushruta as the Sravamarga Utkartana. You'll have to put in a probe in, make an incision, and then keep the tract open, fistulotomy, so that it drains continuously and heals by itself. Secondary healing would happen. Seton is, you insert a seton, that's a non-absorbable thread, through the internal and external opening, and then it has to be tightened regularly so that the tissue is cut, instead of changing once in a week. Now, with the Kshara Sutra, the modification is, in the Kshara Sutra, instead of using a non-absorbable thread, we use a cotton thread which has a coating of Kshara with, of course, Sneak Kshara as a binding agent, or maybe now you have lots of innovations there. Then the track is cut by changing that at an interval of once in a week, whereas in Seton techniques it is not cut, instead it is twisted so that the tissue gets cut through at regular intervals, maybe once in a week or maybe once in 2 weeks. It's just twisted so that it comes out, and the whole fistulous tract is cleared off, along with the healing with the fibrosis at the tract as such. So principle of Kshara Sutra and Setan are otherwise similar. The only difference is in the Kshara Sutra we change the thread once in a week instead of keeping the same material for whole day, and then it's not a simple thread. In the thread you will apply the Kshara, which will have its own medicinal values. Advancement flap procedure is once you have identified the tract, you put a probe in, identify the internal opening, and then with a proctoscope locate the internal opening, make a small incision around that internal opening, pull down the mucosal membrane, lift up, pull down the mucosal membrane and suture it so that the internal opening is covered. So when the internal opening is covered, naturally the further contamination is reduced and there is a possibility that the wound will heal. But there is always a risk option, and the success rate is not very high in this technique, but some selective patients can be operated upon which can give good success with relatively minimum damage of the tissues. In the fistulotomy, there will be more damage to the tissues, and in the high anal or fistula, patients with multiple tracts, etc., that fistulectomy or fistulotomy surgery will be quite difficult. In case of high rectal fistulas, like produced due to Crohn's disease or so on, a flap procedure can be more helpful because the removal of the fistulous tract would be almost impossible in such, and when the sphincter will be damaged more, that kind of situation. This kind of a procedure where the internal opening is blocked either with a flap or maybe with the plugs. Now plugs, I will show you that later. This would be one of the better options by which the contamination is reduced and the possibility of healing is done. In the lift technique, it's again a similar issue. You'll have to put a probe and then identify the area at internal opening, and that internal opening at that area you'll have to close the tract, either suture the tract as such inside, from inside, so that the external portion doesn't get contaminated. That's again the same procedure, similar procedure. Endoscopic ablation is now you will have a specific endoscope which follows the guide wire. So with the guide wire you will have to identify the fistulous tract, and then with the laser beam or maybe with the cautery you will have to cut down the tissue in between. It's a fistulectomy surgery. The only difference is instead of making an incision from exterior, you will be cutting the fistulous tract from within, and if necessary you may have to put a clamp. So external injury would be lesser, but risk of sphincter damage does exist. Chances of residual lesions also are high. So success rate is not very much, but still endoscopic ablation can be one of the options. Fibrin glue or bioprosthetic plug are, you identify the internal opening, and through the internal opening either you inject a substance which will, fibrin, which will be blocking that area, the internal opening, or in a bioprosthetic plug you will have a ready-made plug which can be inserted in and then kept closing that internal opening. So the principle is the same, that the internal opening is closed so that the contamination of the tract doesn't occur and then it may heal. So these are the different options of the treatment. Now the last is Chidra Durdum Haredostham Asho Yantrasya Yantravit Tato Bhagandaya Dadyava Yetad Arthendu Sanibham. The Bhagandara Yantra and Asho Yantra are discussed as two different yantras in the yantra list as such. But when it comes to the question of description, there is no difference between the Asho Yantra, Bhagandara Yantra in that context. Now, in the context of bhagandarachikitsa, Sushruta mentions like the same Bhagandara Asho Yantra where the outer edge is cut off so that it becomes simple tubular structure where you do not have that holding structure, that becomes a Bhagandara Yantra, so that the access or the reach of the instrument can be more. A proctoscope without a edge at the side can be considered as a Bhagandara Yantra. That's all, a light modification. That's all the important issue. Then once you have treated the Bhagandara, because the chances of the recurrence are high, at least for 1 year, patient has to avoid any rigorous exercise or sexual indulgence, psychological disturbances, traveling on vehicles or heavy substances have to be avoided for at least 1 year so that the wound will remain healed. Vyayamam, Maithunam Kopam, Pristhayanam Gurunija. Samvatsaram pariharet uparudha pranonaraha. With this, we will conclude this chapter. It is Sushrutammitayam Chikitsasthane bhagandarachikitsam nama asamodhyayaha. If there are any questions, we will try to answer and then wind up. Right, there are no questions. Right, okay, thank you.
Thank you, sir.